Today, it's all about the new makeup for use after surgery and how do you take someone from an 8 to a 10? Hello TLCers, happy Christmas! I'm here today to give you some festive fun with fillers, little joke there, and also a little stocking treat for you. So this is a makeup that we can use after surgery. Now, why would you want to have a special makeup for use after surgery, I hear you ask? Well, the reason is, if you've got broken skin, an open wound, you don't really want to be applying your makeup brush that's been sat in the bottom of your makeup bag for like 6 months that you haven't cleaned in forever and that your dog has probably chewed, because you might get an infection and that would be very, very bad. So there are certain brands which make makeup for use after surgery which allow your skin to breathe. And this one is really interesting because it's got single-use makeup capsules inside here. So let me open it up for you. It's called Dermo Corrective and it comes in 3 different colours. Now, I know you're thinking, well, 3 different colours, that is not going to match me. Well, yeah, I mean, you're kind of right, because it only has it for probably people up to about a Fitzpatrick 4, which, if you're not familiar with the Fitzpatrick scale, that would be somebody who has got maybe olive skin, think Italian, Spanish, maybe Arabic, that sort of skin type. They don't do anything darker at the moment, unfortunately, although you never know, it might be in the pipeline. So the box comes with 2 smaller boxes inside it, and one of them is a hydrating base and then the other one's got the colour in it. So let me just show it to you. So inside you've got all these little capsules which look like this, and that is, it's just to put on as a primer before you put the colour on. And then in the other one we've got the colour in a little capsule as well, so you get 2. So what you do is you break it. This is probably going to go horribly wrong, but let's see. Ooh. So you break it like that, you squeeze out the makeup onto, well, in my case, on the hand, and then you rub that in, and that just gives a base before you put the actual colour on. I will give myself away here as not being a makeup artist. But you can see there's no colour there. It just feels kind of a bit smooth and silky. And then we do the same thing with this one. I'm actually wearing my boyfriend's top today, so if I get makeup on his top, he's probably going to kill me. And rub that one in. You can layer it if you've got bruising. So imagine you've had, I don't know, you've had a rhinoplasty and you've got bruising underneath the eye. How are you going to cover that up if you want to go out? Well, this would be a really good option for you. You can use this after non-surgical work. So say you've had fillers done and you need to go out that evening. Maybe you're going to dinner or something like that. Again, you can use this. I really prefer it if patients don't wear their own makeup immediately after they've had a filler procedure, because I want to try and avoid that risk of infection. It does say in the aftercare, don't put makeup on for 24 hours. I think the percentage of people who actually listen to that is pretty low. So I try and circumvent people applying their own dodgy makeup by giving them some of these afterwards. And it looks pretty good. I don't know if you can see that from where you are, but it matches me very well. This is the lightest shade that they do, which is a 0.2. But it also comes, as I said, in 2 darker shades as well, which we have at the clinic. And they do tend to match very well different skin colours. So it seems to change according to what your underlying skin base is. So if you are in need of any post-surgical makeup, definitely check out Dermo Corrective. Okay guys, so everybody knows that Botox and fillers exist. It's a thing. But not a lot of people know how we can use them to give you an upgraded look, to smooth out any lines and wrinkles that you might have and to restore the contour back to the face. It just makes you look a little bit fresher more healthy, like you've just been to some fabulous spa for Christmas, because this is a Christmas episode. Okay, so let's check out these before and afters. So these are taken about 2 weeks apart, roughly, and I'm sure that anybody can see that we've got some static lines and wrinkles here in the before shot, and afterwards, not so much. And that's obviously because we've used Botox in that area. We've also added some filler in the temple area. So can you see how it's kind of hollow here and there? It's just a bit more smoothed out. And that has the effect of slightly raising her eyebrow as well on that side. If you look, it just looks a little bit more lifted here and just a little bit rounder where we've added the filler over here. Can you see that? And it means that the upper facial third just looks so much better, because we've combined using Botox and fillers there. Coming down the face, we've added some volume, and this is my favorite area to add volume because it makes such a big difference on most people. We've added some volume in the front part of the cheek here, and importantly, we've also added it in front of the ear right there. Can you see how we've got this concavity there, and then in the after picture she's still got a cheekbone, you know, she still looks like she's got a chiseled cheekbone there, but in front of her ear it's much flatter, and that has the effect of lifting this tissue up on both sides there, so she doesn't have this horrible shadowing that you can see in the before picture. And then moving down, we've added some filler right here as well in the nose to mouth line. I mean, that's a very classic area to add dermal filler. Most people know that they can have their nose to mouth lines filled. This tends to be something that I do last of all, because I like to give the stability in the mid part of the face first before I do the nose to mouth line. Right towards the end of this video, you're going to see me doing something a little bit interesting in the nose to mouth line as well. So she's got this tethering of the muscle to the skin. You can see right there, you see just how it pulls a little bit there. Well, if you use a cannula, you can break the connection between the skin and the muscle. It's called subcision. And it means that when she's smiling and animating her face, it's not going to give as much pull in that area, which means it will help that line become a lot more soft. And then in the lower part of the face, we've added some filler in the chin area here. It's kind of like in this weird telephone shape like that. That's where I've added it, see here. And we've gotten rid of some of the asymmetry. So can you see how there's a big concavity there? And here it looks a lot more smoothed out. I have done a very subtle lip augmentation for her too, because of these lines. So you see these vertical lines all the way around, specifically on the lower lip and the upper lip as well, actually, kind of a little bit. We've just given a bit more lip definition and helped to smooth out the lines too. So let's go over and see exactly how this was done. Okay, so let's start with doing some Botox to the glabella, the crow's feet, and the forehead. So the glabella is the area in between the eyebrows, and I often start by doing this because it's a nice easy win. It's a nice quick way to soften the lines with very, very minimal risk and very, very little downtime. This is another classic area that I'm injecting now. We're putting some dermal filler in front of the ear using a cannula. And in most people, this area is one of the first to go, I find. The fat here, it just shrinks away and it allows the tissue to fall down, which makes the face look heavier and more jowly. Next, we're going to move on and inject the front part of the cheek. Again, this is a really, really common area for me to inject using a cannula. Just reinflates the fat which has been lost. And you can see that we're doing this quite deeply in the tissue there. It's so that when she's smiling, the product doesn't move with the muscle when she's smiling. You know, sometimes when you see people who have had their filler too superficially placed in that area, it comes up like a big ball right here when they're smiling, which is not a good look, especially at Christmas time. When I'm doing this procedure, I take the product right up to almost underneath the tear trough. So if you check out her before and afters, you can see that there's a smoothness underneath the eye, which wasn't present before. And that's without having to actually inject the tear trough itself, which can be a little bit of a procedure with slightly higher risk. I'm also doing the base of the nose now. So as we age, the nose kind of collapses into itself. So by adding volume there, it helps to give it a bit more projection and also smooth the hill and valley where the nose to mouth line is. So let's take a look at a half and half here. So you can see here, we've done her right hand side. That's your left. I'm talking about the anatomical right. Sorry to make it so complicated. And you can see that the whole side of the face, so the whole cheek on that side, has been lifted and elevated, giving it a smoother appearance. Let's just quickly check out a smile. Sometimes people worry that they're not going to be able to smile properly after they've had fillers, but as you can see, we've only treated one side of the face and she's smiling and it all looks great. Okay, so moving on now to the chin, which I think is a really undertreated area. Often when I suggest, do you know what, we should probably put some filler in your chin, about half the time I'm met with a look of puzzlement and astonishment, but it does really make a big difference. So you can see here I'm using a cannula to augment the crease across the central portion of the chin. And from the same entry point, we're going to now move down and do the point of the chin. So you can reach both of those two areas from one insertion point, which is great because it minimizes your risk of bruising. And now, again, from the same insertion point, we're going to twist that round and do the marionette line. Now this is great because it means that you get some more lip support as well without actually doing any lip augmentation. Let's have a look at that. So now we've got a half and half with the chin finished on one side and not on the other. So it's the left side of the screen, her anatomical right, which has been treated. And you can see that all the shadows there have been completely smoothed out and it just looks almost like she's been airbrushed. Check out her smile now. Can you see how the smile looks different one side to the other? So the side which we have treated, her corner of her mouth, it elevates up more than it does on the side which is untreated. And that's due to the effect that the filler has on the muscle. You can also see less of the lower teeth on the treated side. And that's because the whole smile has been moved north slightly, which gives a more attractive look. As we get older, we show more and more of our lower teeth. So in our head, we think lower teeth looks older. It's an aging feature. So if we can do anything to stop that from happening, that's why it gives you a more impression of youth. Temple injections now. This is, I guess, one of the areas that people don't ask for so much, maybe because they're not aware how much of a difference it can make. But if you do have a little bit of hollowness in the temple, it can make your eyebrow look lower on that side. So if we add volume in the temple, it will raise up the eyebrow. It just gives you, again, a bit of a softer appearance. Let's just check out that half and half with one side of the temple treated, the other side not. You can see that the eyebrow does just look slightly different on the treated side. Now let's move on to an area that most people worry about filling because they think it's going to make them look a bit trouty. Of course, I'm talking about lip filler here, but there are ways that you can do it so that it balances with the overall harmony of the face. So here we're augmenting the upper lip slightly. We're doing the Cupid's bow and what's called the Glauco Klein point, which is this point here, right at the top of the Cupid's bow. We're also going to turn up the mouth corners slightly so that she just looks a little bit less sad. And we do that by adding some filler right here in the corner of the lower lip. You can see that right now. I like to use the TSL pen when I'm doing a lip augmentation because it makes it really, really precise. And that can mean the difference between getting a good lip augmentation and one that looks great. We're going to switch back to using the Botox now. So I'm adding it in the chin. And the reason for this is as we get older, this muscle right here, the mentalis muscle, it pushes everything up like this. So if we add Botox here, it will help to rotate it back down, and again, it gives you a smoother appearance to the chin. I'm also adding it right here next to the nose, not much, just a very, very small amount, because her smile line is a little bit high, so we're just trying to drop that down slightly. Just makes the whole smile look better afterwards. Last but not least, we're going to do the nose to mouth lines. This is an area that most people come in to ask to be filled. Which is actually kind of weird because it's not an area that I really do fill that much. Nevertheless, we've done the rest of the face, so, you know, in for a penny, in for a pound, let's do it. So we're doing the nose to mouth lines now, and you can see that towards the bottom part of them, they're still there. And that's because even though we've put filler in, she's got this muscular connection there, which is really tight. And when she's smiling or doing anything, that muscle is pulling against the skin, and you can add as much filler as you want in there. It's not going to help. So what we have to do is to break the connection between the muscle and the skin, and we're going to do that with a cannula. So it looks a little bit brutal, but she can't feel it, she's numb, and in any case, if she wasn't numb, it actually doesn't hurt that much. So we just break that connection using the cannula, and when everything's healed, you'll see that there isn't quite as much pulling when she's smiling. So this is how she looks immediately after the treatment. You can see she can go out, she looks fine. If she wants to put a little bit of that Dermo Corrective that I showed you earlier in the video on afterwards, that's totally fine. But she looks good to go. Okay, so that's all we've got time for this week. I hope you enjoyed the episode. Join me again next week where I've got another Guess What We Did. So let's have a look at that image on the screen right now. Just pop your comments below, let me know what it is that you think we did, and I will reveal all next week. In the meantime, don't forget to like, comment and subscribe.